Hello everyone. So in this lecture we are going to talk about brachial plexus injuries. Now, if you don't know what the brachial plexus is, I suggest you go to a previous lecture where I cover it. But in summary, what is the brachial plexus? Well, it's basically this whole network of nerves you have going to and from your spinal cord and along your arms down here. Now, some of it can go elsewhere, but for now, we're just going to talk about the brachial plexus in general. Okay, so there's something that could be result from an injury to the brachial plexus, and this condition is called Erb's palsy. Now, what happens in this is that this is caused by damage to the C5 to C6 roots of the brachial plexus. So if we go to the previous image, that means you have damage to the upper two roots right here, the C5 and C6. So something damaged up here, the most superior part of the plexus. Now, what is a common cause of it is due to obstructor labor during childbirth. So the thing is that there's a lot of things that have to be force that is used during a typical vaginal delivery. But say the narrow birth canal is too narrow and this whole big baby has to pass through that canal. But say the baby shoulder gets trapped and when you're pulling on the baby and trying to get it out, say something overstretches the shoulder right here, and what do you have in the shoulder? Well, you have many tissues, including nerves of the brachial plexus. So something that can happen is that you can have nerve damage during this if you pull too hard and overstretch these nerves over here. So this is something that manifestation and sign of a possible Erb's palsy is that look at this baby's right shoulder right here, and this is a classic sign where what you see is that you see the arm kind of turn in this way, and notice that the hand right here is flexed, and it's also, or the wrist I should say, yeah, the wrist is flexed, but it's also like kind of turned inwards that way, and that's called the waiter's tip sort of a sign. And the other things that can happen, like say this nerve damage and there's no physical therapy and this nerve is permanently damaged, what typically happens is atrophy of the affected arm. So a lack of function and size in there. So here's an example of Erb's palsy. Like this guy looks like he works out to a bit, but look at this arm compared to this arm. This arm has a lot more musculature and is thicker, but this one doesn't have as much musculature as his left arm over here. And what you can see is also that sort of like internal rotation as well, like the baby over there. So that is like a classic sign of Erb's palsy. Like they're not actually flexing it. That's just how it is due to all the muscles being affected and the atrophy of the muscles that would be there or would be controlled by the innervated by the damaged nerves that were ca- that resulted from the Erb's palsy. Okay, so then let's talk about neurogenic atrophy. So what is atrophy? Basically, not necessarily muscle, but it's often used to refer to muscle. But atrophy is a decrease in size, and what we see in this image right here, this guy looks like he works out as well. But what we see is that there over here, the delts are pretty big compared to here. The delts are smaller, and this guy also has or axillary nerve damage. So that axillary nerve innervates the deltoid. And what we see is that he has axillary nerve damage. And the thing about your muscles and the motor nerves is that your motor nerves have, there's a concept called tone. And in a sense, that means like there's always some sort of like contraction happening around in the background. And that's also very important for things like your posture. Like you typically don't just have all your muscles fully relaxed, no tension whatsoever. So without that kind of innervation and without that kind of stimulation that causes tone, that causes the muscle to waste away. So that if you don't have any nerve signals, what typically if you have nerve damage to a muscle, that muscle that was controlled by the nerve ends up atrophying. And that's what we call neurogenic atrophy, when you have atrophy due to some of these peripheral nerves being damaged. So, and here's another example over here. So you can see that what we have here is this is like you can see kind of the difference in the neurogenic atrophy over here. This one's a little less muscular. You can kind of see the bones compared to over here where you see the deltoid. Not so much meat on this deltoid over there. And also you can see this in the legs over here. One leg is thicker than the other. So the thing is that is pretty much use it or lose it. But the thing is that if you have nerve damage, you can't really use it and you can't maintain tone and you can't really maintain the size as easily as you would if it was a healthy nerve. Now, With the brachial plexus, something else that can happen. Now let's talk about the brachial plexus has many branches, but let's focus on one branch in particular. Let's focus on a very important branch called the median nerve. So the median nerve, as you can see, kind of runs here from the elbow all the way, like the median of the forearm. So the thing is that what does it innervate? It innervates many things, including your forearm flexors. So the flexors was going to like flex like that, but like this, and also it's going to innervate the pronator, teres, and quadratus. So again, pronation is when you go like from here and go like that. And then digital flexors. So it innervates multiple muscles involved in flexing your digits like this, but more specifically, it cut digits 1 through 3. So again, 1, 2, and 3. So flexion of that, and also inner half of digit 4. So it's like 1, 2, 3, 4, but only half of this part. Now, the thing is that something that can happen to that is caused by median nerve pathologies or disease is so let's talk about the carpal tunnel. So the carpal tunnel, so carpal means wrist, and you have all these bones in your wrist, your carpal bones, and if you don't know what carpal bones is, I suggest you go back to the appendicular skeleton lectures for that. But basically, you have all these wrist bones that kind of help to form this part right here. So what happens is like when we kind of move our wrist bones to kind of form this little pocket, that something can happen. But the thing is that notice that these, if you take like a cross section right here and go right across like that, notice it forms a partial tunnel down here. And what thing is that your median nerve runs through that. So here's the bony part, but you also have this ligament that spans the from the lateral to medial side of the or lateral to medial side of your carpal tunnel. So it spans across, and that's called the transverse carpal ligament or flexor retinaculum. Either way, it's I like transverse carpal ligament because it literally tells you what it does. It spans the carpal bones and it's a ligament. But either way, what we have is like okay, hard stuff here and a dense band of collagen tissue over here. Now, the thing is that carpal tunnel syndrome, what typically causes it, or what is a this structure itself is called the carpal tunnel, and the median nerve runs through it. There's other tendons as well, so notice that this median nerve it doesn't have much room, and that's key to understanding this. Now, with the what is a sign of carpal tunnel syndrome? So what people typically have, a common sign is paresthesia. So this could be feeling that you have numbness in your wrist or forearm. You might feel tingling, or you could feel pains, or you could feel multiple combination or all of those. And it typically affects the thumb and these first two, or what's it, the thumb and digit 2 and 3, and also 4 to half of 4. And a loss of grip is a common symptom of this as well, because paresthesia is a sensory symptom. But remember that pretty much most of your, except for that C1, is a mix of both sensory and motor signals. So both signals going from your body to your central nervous system, but also commands from your central nervous system to things like skeletal muscles. Those are motor signals. So if you have problems with your motor signals along your brachial plexus and this median nerve in terms of like your hands is going to be 1, 2, 3 and a half. So try to grip something with your full hand versus trying to grip maybe with only your these two over here. And that's like, and you're only going to have half strength here. So it's going to be a lot harder to grip something with just your little finger, digit number 5, and half of your digit 4. So that's why loss of grip is a common symptom of carpal tunnel syndrome. But there's many causes like repetitive strain, or maybe like compression of the nerve, or having poor ergonomics when typing, or like, and there's a lot of sports injuries that can result in that either way. But all of them, they involve the median nerve. So something is happening to that median nerve. And again, the innervation of here, if we're talking about motor control, what we see is that, again, your median nerve innervates most of your fingers and a big good part of your palm over here. So if you take that out of the equation or make this weak, then that's going to really affect your grip. And what we see is that here's like, and ergonomics referring to like correct position when you're doing things like tasks and daily things. So like with typing, they tell you that if the correct way to type is like you're typing like this, like you should keep things pretty flat. You shouldn't type like this or like this. And same with like a mouse. You shouldn't have the mouse like I was saying is like don't bend your wrist like this and don't bend your wrist like that, because why? when you bend your wrist, you're also putting pressure on your median nerves. So basically, it's like if you keep it straight like this, your median nerve stays aligned and you don't have compression of it against your carpal bones or your that transverse ligament. So either way, that's why there's a correct and incorrect position if you're talking about like using your keyboard and mouse. So how do they diagnose it? They could do a nerve conduction test to see if there's any change in like this. They measure the electrical activity, apply a current, and see how your nerve conducts that electricity. And there's Tinel sign. So Tinel sign, it's a kind of like a it has somewhat moderate way of detecting carpal tunnel syndrome, but what something called sensitivity. But we won't get into that statistics. So what they do is if you've ever had this or tried to get diagnosed with carpal tunnel syndrome, they might tap with two like right here on your wrist, where on the suspected wrist that has carpal tunnel syndrome, and that's Tinel sign. If you feel some sort of tingling, it could be tingling, it could be pain, it could be something. Or like one time there was a student and we did a demonstration and she felt she said like you could see her jolt, it went up her entire arm. So that is like classic Tyndall sign. There's also the Phelan maneuver and other maneuvers as well, and what they're doing is pretty much bending the wrist right here. And remember that your median nerve is going to run this way, so if you're bending it and putting a kink in it, you're putting a lot of stress and compression on that nerve. So the thing is that if you start getting the tingling, numbness, or something after a certain amount of time, that is the failing maneuver. Okay, but again, if you suspect that, I can't diagnose you online, but so go to an actual doctor to see get diagnosed if you think you have that. So how do you treat that? Well, keep that median nerve aligned. You don't. So this is why the carpal tunnel brace right here, it's going to keep that median nerve, and it's going to be really hard and actually pretty much impossible to really bend your wrist like this or this, so that you don't. So it kind of relieves the pressure on that median nerve. And if that doesn't work, one other route is the surgical route. So what happens here is that, well, you don't want to mess with your bones, but in this case, what they're doing is going to cut this transverse carpal ligament right here. So yeah, it might seem like, oh, so you will lose functionality in that because you just cut a big band of tissue that helped to form your wrist over here. But what hopes is like, okay, it's kind of like undoing the belt. If you say you eat something a lot and your belt is too tight, it's kind of like undoing the belt and hoping that real reef, when you put it back on, it's going to be looser than it was before. And that's what the whole goal of this surgery is. And you might see the transverse carpal ligament, also called the flexor retinaculum. I like transverse carpal ligament because it literally tells you it's a ligament, it's on the carpal bones in your wrist, and goes across. I love that in term, but yeah, that's just FYI. And if you have the slides, you'll see this picture right here. YouTube is kind of squeamish about surgery. That's why it's a little blurred. But that's something that they used to have to go all the way, like pretty far up the forearm. But now, or like cut up like a lot of the wrist sometimes. But now they're more like trying to go laparoscopic, where you don't have as big of cuts as they used to do before. And they see similar results as well. All right, so those were just two things that can affect the brachial plexus. So we talked about Erb's palsy and carpal tunnel syndrome. There are more things that can affect the brachial plexus, but in this case, these are a pretty common thing, or actually, these are things that could happen, especially carpal tunnel syndrome. That's super common.